Welcome to Innovation in Action, the podcast series on innovating in uncertain times. In this program, we look at how the XPRIZE Foundation and BT Global Services are pushing the boundaries of innovation within healthcare and life sciences. We all know that healthcare around the world is in trouble, particularly in the United States. So why would an XPRIZE create any change when so many have already tried? And how can a global communications company help one of the oldest universal healthcare systems in the world control costs while delivering better care in the community? U.S. healthcare today is simply unaffordable, with premiums for family health coverage exceeding the income for minimum wage workers. Even President Barack Obama has healthcare high on his agenda. Yet while most Americans agree that reform is needed, no one knows exactly how this should happen. That's why the XPRIZE Foundation, together with the WellPoint Foundation and WellPoint Inc., the largest health benefits company in America, has released the design guidelines for a $10 million XPRIZE on healthcare for public feedback.
We're going to be asking teams around the planet to come forward with their best ideas of how to reinvent healthcare.
To identify the key components that could lead to real transformative changes in the healthcare system, the XPRIZE Foundation and WellPoint collaborated with leading healthcare experts from across the nation.
The Healthcare XPRIZE will source ideas, will invite teams from anywhere on the planet, ideas from any place on this globe. And the competition will actually take place with population sets in the U.S. It's going to be, for us today, the most practical way to do this. But the concepts that come out of this will be open source and will be available to teams, companies, governments to open and implement anywhere.
The grand challenge with this XPRIZE is to create a new optimal health system that empowers and engages individuals and generates a 50% improvement in a measurable health value of a community. In other words, it will be looking at ways of extending the value of what people currently get out of the system while reducing the total cost. After the launch of the prize, teams would have 18 months to conceive, model, and submit plans to create a new paradigm that can improve the health value. In addition to sponsoring the development of the prize, WellPoint has committed to testing the selected finalists in real markets to determine which innovation can deliver the most healthcare value.
We think we can create that value in healthcare so we can deliver and create access for all Americans, deliver to them an affordable healthcare benefit so we can cover all Americans. And like transparency for our consumers, we're going to be open in the XPRIZE competition to make sure this is a transparent process that will change the game for healthcare overall.
Ultimately, why this might work is because it's an incentivized competition that is going to allow teams to self-organize and try things that they're willing to take a risk on to try and bring about a breakthrough. Very different from groups that think and talk about it and then set up policy that then has to be tried.
As part of the prize development process, the public and interested stakeholders are being asked to comment on the initial design of the Healthcare XPRIZE to ensure that we will all benefit from the launch of this competition. An aging population with increased life expectancy is starting to severely challenge many healthcare systems around the world. In England, the National Health Service has been looking for solutions that increase efficiency, yet meet the needs of the future. Since 2004, BT has been upgrading the NHS nationwide network, significantly reducing the costs of communicating across this vast community. In a typical month, more than 140 terabytes of data cross between sites connected to this new network. Before, this information went by post. Using BT-managed IT services, one pioneering program in North Lincolnshire now gives community health workers remote access to electronic integrated clinical records, enabling them to work seamlessly across a variety of care settings.
The clinical system works exactly the same way on the Toughbook as it would on the network, the same speed and the same retrieval of patient records.
Catherine is a clinician with the NHS North Lincolnshire Trust. Technology allows her workday to begin at home instead of the office.
I can check my visits for the day, I can retrieve a patient's record, I can see that integrated record prior to my visits and plan my working day.
North Lincolnshire NHS covers a population of over 320,000, served by 58 rural and town-based GP practices. Many clinicians visit 40 or more patients a week. By not having to frequently go into the office during the day, much time is saved.
Having mobile technology means that we can view the patient's record wherever we are, and that's usually within the patient's own home. What it allows us to do is see all of the patient demographics, so their age and their address. It also allows us to look at their past medical history, their medications, and any treatment that's been planned by any other service.
What we can see is the absolute potential to transform the way that we provide services and improve patient care.
I've got everything at my fingertips that I need to prescribe and diagnose safely. The patients actually love it because they can see at a glance the communications from secondary care, they can see their results.
It's probably the most important step in my health life. It's completely transformed my expectations of the National Health Service. She's come round, we've established a relationship, and she has been able to not only be diagnostically involved, but she can also suggest treatment for me. And not only that, she's connected to all my history in a medical sense from the practice through this wonderful laptop.
Preserving patient confidentiality is vital too. All the clinicians are logged onto a secure BT network, and no information is actually stored on the device. The North Lincolnshire NHS Trust chose BT Health to support the setup, deployment and training for this pilot program.
The focus in Northern Lincolnshire was very much about delivering better quality care. BT have been an excellent strategic partner in supporting the deployment of the system. It's a very technically complex system, and we needed their full support to deploy this system through training, configuration of the devices and supporting the change management process.
Probably over the last 10 years we've gone from being an organisation with fixed workers working in a fixed environment to people working in a more mobile and more flexible way. So the pain that the NHS and the challenge that the NHS are facing right now is something that BT have already gone through and learnt from.
ICT technologies are a very critical part to delivering any solution, particularly mobile health working.
You've got to have a device that's fit for purpose. So it's got to be lightweight, it's got to be easy to carry, it's got to have a battery life that lasts a full shift, otherwise the nurses won't use it. The key area for the whole solution is more around managing the change, managing the cultural change and supporting that change.
Modern medicine depends on timely, accurate information, efficient care coordination, and reliable technology. These are just some of the benefits of the BT Mobile Health Worker. Peter Diamandis is the founder of the XPRIZE Foundation. He is also a serial entrepreneur, having founded Space Adventures, Zero G, and the International Space University in Strasbourg, France.
For a company to continue to be successful, they have to innovate. It's about keeping yourself fresh and relevant to the marketplace. It's about allowing people to take risks, to drive breakthroughs, to invent new ways to do things more efficiently. It's about creating an environment that allows your customers and your employees to figure out the future together. The company that doesn't innovate in tough times is the company that dies. You know, my motto is evolve or die. At the end of the day, you're going to have to figure out a new way to do things more efficiently, come up with new products, because stagnation is death.
No other industry sector is more dependent on innovation and radical breakthroughs than healthcare and life sciences. With ever-increasing costs and a limited shelf life for patents, this sector cannot afford to rest on its laurels. Well, that's it for this program. Both the XPRIZE Foundation and BT Global Services are world leaders in fostering innovation. As a result of our unique partnership, you can keep up to date with more case studies from both organizations by subscribing to our Innovation in Action podcast series.